Good morning, everyone. Good morning from Warsaw. Thank you very much for your kind invitation for this ICARUS meeting. The custom seal technology is very promising because of very unique action on the neck of the aneurysm, where we can avoid of stent outward pressure and the neck dilatation. Actually, the altar can be packed into 15 French OD introducing system thanks to eliminate some struts and metal struts that can help to reduction in profile without compromising durability of the stent graft. There are a couple of differences between Ovation IX and the Alto system. The most important thing is that the sealing ring center is only 7 millimeters, so we can treat patients with the neck shorter than in Ovation IX. And there is also offset of aortic body legs. And I mentioned about the liver system. So we have a new auto-injector, and what is important, there is a lower pressure to bring a polymer in place through the net of tunnels. And there is a webbing and a graft bifurcation that helps to cannulate contralateral leg. And the very important thing is the integrated compliant balloon position exactly at the level of the first ring and the mid-crown. We achieved a new device, but we have to remember that we still need a 7 millimeters healthy neck with a thrombus. It should be less than 8 millimeters in thickness, and we are lack of significant calcification of that level. And we have to remember that conicity should be less than 10% as measured from the inferior renal artery to the aorta, 7 millimeters below the inferior renal artery. Packed into low profile 15 French delivery system that is designed to reduce access and side complications and of course facilitate percutaneous delivery. There are some other unique features in Alto. One of them is integrated compliant balloon. I mentioned about this, and can offer us intraoperative deployment to optimize seal of the polymer sealing ring. And the other one, very useful, is integrated crossover lumen as an alternative to retrograde cannulation facilities that can help to cannulate contralateral gate access. Our experience with the Ovation in HIT Warsaw. So we treat more than 100 patients when we participate in LUCI study. And what is important, nearly 1/3 of patients with very significant angulated necks. There are some pictures from our institution where you can see a challenging anatomy of this group of patients. Our first implantation of Alto system took place in November 2020, and because of pandemic, we have now a chance to do a lot of patients with this system. Actually, we treated 4 patients have been treated. Our first patient was a female with a diagnosis of aortic arch aneurysm as well as a AAA aneurysm and bilateral popliteal aneurysm that we left free. There are pictures from our cath lab when you can see implantation of fenestrated of custom-made Relay Pro into aortic arch successfully. And after that, we start the Alto procedure for AAA. But during implantation, we noticed endoleak type 1 that was fixed with a balloon. That was very important, and with a Palma stent successfully. And here you can see the final story of that patient. The second case was also not very easy because it was a patient with bilateral iliac artery aneurysm coexistent with a AAA, relatively big one, nearly 8 centimeters. And we start with a excluder iliac branch devices on both sides that you can see here. And because of the neck angulation, we decided to implant an alter and join it with the excluder technology, and finishing this procedure successfully, what you can see on that slide. In the first case, it was a patient with diagnosis of asymptomatic AAA with bilateral iliac artery aneurysm with a large hypogastric artery aneurysm on the right side. And in this patient, we decided first of coil embolization of hypogastric artery. You can see a lot of coils putting into the aneurysm on that side, on the right side. And after that, alter device was implanted successfully into the AAA that you can see here, the final angio of that patient. So let me share with you some remarks, rather the conclusion. So our experience with polymer sealing technology is based on Ovation iX, and we find it safe and effective. And that's why the Alta system, with its design improvements and some modifications, in our opinion, offers the wider range anatomical indications, and the implantation of this device is simplified. Thank you very much for your attention and for invitation for ICARUS Congress.